have it, and we want to continue even further because we have some more things to do, because I also want to see at least I want to have a 3D data set. So here we have the 3D image. We can use the multi-slice, and then we see the ventricle from the base to the apex. Here we're even in the atrium, and here we want to have the left ventricle. And you see that image quality is not optimal, so we can do two things. So he can inhale again, and then we can also use more than one beat. So if you have only these 3 beats, then it won't be optimal. But we reduce to 1 cycle. Und bitte wieder einatmen. Stop. And as he inhaled, our image is a little bit better. Now we see it better, and then we use the multi-beat. So now it's calculating 6 beats, it's like in MRI, and then we can save it. Weiteratmen. Perfekt. And also we tried again in this case, normal weiteratmen. To have the optimal image first. Ein bisschen einatmen wieder. Stopp. Und so die Luft anhalten. Perfekt. And then multi-beat. Of course, the patient should be able to hold his or her breath, of course. But here we have a nice image. Perfekt. Weiteratmen. Now we have the 3D data set. The one thing that is still open is one thing you can sometimes easily forget. Diastolic dysfunction. We also want to see it in this case, and we have the E-wave we have to measure, and of course we need to use the tissue Doppler, not only for the right ventricle but also for the left ventricle. Here we have the E' medially and the E' laterally. And you also hear that's a nice tissue Doppler signal, and I always have more than one signal to compare in atrial fibrillation what's the average signal that you should overall do. Now, as we have implemented all of this in our imaging, the one thing we still want to do is contrast imaging. For contrast imaging, we need a contrast agent. We have it here. In our case, it's SonoView. We need an IV access for the patient, and we need a specific preset. So this is called the LV contrast preset. This makes I just show you, I just want to show you a normal B mode, and you see that this is all very blurry. That's the optimal contrast preset. So you see that the mechanical index, all the gain settings and much more settings are optimized for the bubble study. So this is a left ventricular contrast imaging. So we now use the contrast agent. We only need 1 milliliter, not much more. We just take it out, and then we administer it to the patient. And as we only have one patient today, we can attach it again. And normally you can have this for at least 5 to 6 patients. And danke dir. Now we can look at our image, and we already see that the contrast is in the left ventricle, so it's passing the right ventricle. We also can get a glimpse of the right ventricle seen over here, but especially we want to focus on the left ventricle. And I personally also prefer rubin. It's a better color for my eyes, so I'm used to it, so we're using it now in this case. You can also, and now we want to have 3 cycles again. We also can use a yellow contrast. This is not my favorite contrast setting, I have to say, even though I see it good. So I prefer the rubin, so the red contrast study. Now we also save this, and when we have the 2-chamber where we optimally can see the entire cavity of the heart, and we save it, and also in this case the apical 3-chamber view, the apical long axis view, we see everything. Noch einmal einatmen bitte. Danke. Und die Luft anhalten. Inhaling again helps. And that's the 2-chamber view. And again the apical 4-chamber view. Perfect. Weiteratmen. Danke. And furthermore, the last thing we still can do is we can also use the triplane mode in the contrast setting. And in this case, you see it's better. So still we would have to adjust the angulation a little bit, and that's just then playing around so that you have it optimally. But in this case, I'm not too unhappy with what I see, so we can take it. And one more thing I want to show you in these high-end machines is you can use even 3D, 4D contrast imaging. There you need more gain, and here you have the cavity of the left ventricle, And also in this case, you can go to the multi-slice imaging and see from really the beginning of the left ventricular cavity till the apical regions that there is no aneurysm present, but this hypertrophied heart. So as we now finished our evaluation, we can summarize. One more thing I wanna do is I wanna show you the subcostal approach just quickly. You can, of course, the patient can lie in a supine position, but we simply continue now on the left lateral side, because just for showing purposes, here you have the heart from a subcostal approach, no pericardial effusion. Also the IVC is slim. Here you can even see in the greater depth the SVC. So we have the IVC and the SVC. Then the last thing we need to do, kannst du am Rücken legen bitte, is scan the lungs. So what we normally do is we scan from anteriorly. We can also use a linear transducer if we have it, or we can simply use this transducer to see artifacts. We do not have any, and then we continue with pleural effusion, which we also do not have. So we would look here for the pleural effusion, left and right side. So to summarize this imaging, we do have myocardial thickening. So in our evaluation, it turned out the patient has a hypertrophic obstructive cardiomyopathy.